My name is Ralph Nanan from the University of Sydney. I'm delighted to present our paper entitled Self-Reported Racial Group-Associated Immune Signaling Differences in Atopic Dermatitis and Dupilumab Treatment, in which we examine the potential implications of self-reported race in atopic dermatitis and Dupilumab treatment responses. For this purpose, we exhaustively surveyed the gene expression omnibus for transcriptomic datasets in the context of atopic dermatitis and Dupilumab treatment, involving individuals of diverse self-reported races. Only one study was found by Gutman, Yaski, and others. This in itself demonstrates the underrepresentation of racial ancestral factors in atopic disease research and treatment. In their study, they analyzed the lesional and non-lesional skin biopsies from atopic dermatitis patients at different time points throughout a 16-week Dupilumab treatment period. And they did this at a transcriptomic level based on a multi-center, placebo-controlled, double-blind clinical trial. They covered individuals with self-reported races of white, non-Hispanic or Latino versus Asian. At baseline, week 0, EASI scores and scored scores, as well as gender profiles, were similar in both groups. They also exhibited comparable reductions in EASI and scored scores as treatment responses to Dupilumab. We then analyzed their data performing gene set enrichment analysis on transcriptomic data from skin biopsy samples at different time points, comparing white and Asian groups. We did this at baseline, and 134 and 117 pathways were upregulated in white versus Asian individuals in lesional and non-lesional skin areas respectively. Among the 34 pathways elevated in white participants at both lesional and non-lesional sites, IL-4 and IL-13 signaling pathways, the main target of Dupilumab, and IL-10 signaling pathway consistently featured. This pattern persisted in lesional skin areas at 4 weeks post-Dupilumab treatment, but dissipated at the 16-week post-treatment time point. These self-reported racial differences we found may have implications for informing atopic dermatitis patient clinical stratification and personalized medicine treatment options with Dupilumab, regarding the dosage and the duration of Dupilumab. However, there are several limitations in our study, as atopic dermatitis pathogenesis and treatment processes are multifactorial and are known to be influenced by various environmental factors. Specifically, self-reported racial groups are social but not biological constructs. They represent an imperfect proxy, partially capturing the combined effects of genetic ancestry, the exposome, and societal factors that can influence immunity. Future studies will have to validate our findings. Ultimately, our findings also highlight the pressing need to increase racial ancestry diversity in atopic research promoting health equity. Thank you.